Imagine a thief robbing the body of its lifeblood. That's shock, a terrifying medical condition where organs and tissues are starved of oxygen-rich blood. For nurses, understanding shock is not just about textbooks, it's about recognizing subtle signs, acting quickly, and potentially saving lives. This essay delves into the world of shock, equipping nurses with the knowledge to combat this silent threat. Shock is a race against time. When blood flow falters, cells begin to die. This can lead to organ damage and, in severe cases, death. Nurses are often the first line of defense against this deadly cascade. By understanding the causes, stages, and treatments of shock, nurses can provide critical care when it matters most. The human body is resilient, often masking the early signs of shock. However, as a nurse, you are trained to be a detective, looking for clues. Is your patient's skin clammy and cool? Is their pulse racing? Are they confused or disoriented? These subtle signs can point to the early stages of shock. Prompt recognition is key. The sooner shock is identified and treated, the better the patient's chances of survival. This guide will equip you with the knowledge to not only recognize shock, but also to provide effective, life-saving care. Remember, in the battle against shock, knowledge is your most powerful weapon. Shock unfolds in stages, each marked by the body's attempts to compensate for the lack of oxygen reaching vital organs. Understanding these stages is crucial for nurses to gauge the severity and tailor interventions. The first stage, compensated shock, is a silent alarm. The heart races and blood vessels constrict, diverting blood to vital organs. Nurses might observe an increase in heart rate and slight elevation in blood pressure. As shock progresses, the body's efforts begin to fail. Blood pressure plummets and the patient's mental state deteriorates. This is a critical juncture demanding immediate medical intervention. The final stage, irreversible shock, is a tragic testament to prolonged oxygen deprivation. Despite aggressive interventions, the damage becomes irreparable. Early recognition and aggressive treatment are crucial in the fight against shock. Shock manifests in different forms, each with unique triggers and consequences. Understanding these distinctions is paramount for effective care. Let's explore hypovolemic, cardiogenic, and septic shock. Hypovolemic shock arises from significant blood loss. This could be due to trauma, surgery, or dehydration. Imagine a water balloon losing its contents. Cardiogenic shock stems from the heart's inability to pump blood. Think of a failing pump struggling to push water. Septic shock results from an overwhelming immune response to infection. Imagine a fire alarm triggering a chain reaction. Each type of shock demands tailored nursing interventions. Recognizing the root cause is the first step. In the high-stakes world of healthcare, teamwork is not just a buzzword. It can be the difference between life and death, especially when battling shock. Nurses, as integral members of the healthcare team, play a crucial role in coordinating care, advocating for their patients, and ensuring that everyone is on the same page. Imagine a well-choreographed dance, where each movement is synchronized and purposeful. That's the power of teamwork in shock management. Nurses communicate vital signs, relay patient concerns, and collaborate with physicians, respiratory therapists, and pharmacists to ensure timely and effective interventions. Effective communication is the lifeblood of this coordinated effort. Nurses act as the patient's advocate, ensuring their voice is heard and their needs are met. They provide critical information to the team, enabling informed decisions and prompt adjustments to the treatment plan. When facing the formidable opponent that is shock, teamwork is not just an option, it's a necessity. By fostering open communication, mutual respect, and a shared commitment to patient well-being, nurses contribute to a cohesive team environment where every member plays a vital role in the fight for a patient's life.